Dear students, welcome to EPG Pathshala. This is Dr. A.G. Sinha, a professor in the Department of Physiotherapy, Punjabi University, Patiala. The subject matter of this module is therapeutic ultrasound. Ultrasound is the most commonly used modality in the management of sports injuries. Ultrasound produces both thermal and non-thermal effect, and most of the effects produced by the various therapeutic modalities can be produced by this modality. This makes this modality a versatile tool that has application in many situations. In comparison to other modalities, the ultrasound has relatively few side effects. The advancement of technology has made it possible to construct portable ultrasound units that can be easily taken to the field. However, the ease of application, portability and less risk makes this modality the most inappropriately utilized one. In this matter, we will talk about the therapeutic ultrasound. We will discuss the nature of ultrasound, its biophysics, its interaction with tissue and the effects produced by the ultrasound. We will also use this information to decipher the therapeutic uses of ultrasound, and at the last we will talk about the contraindications of the ultrasound. The learning objectives of this module are: understand the meaning and nature of ultrasound, know the method of production of ultrasound, explain the effects of ultrasound on human body, understand the role of ultrasound in treatment of sports injuries, and know the adverse effects and contraindications of ultrasound. In the field of medicine, ultrasounds are used for two purposes, one for imaging and another for the treatment. The use of ultrasound to image the internal organ is the field of expertise of radiologist, more appropriately called ultrasonologist. These experts use ultrasound beam to get the image of internal soft tissue organs such as intestine, bladder, kidney, which cannot be seen through X-rays. The use of ultrasound for treatment purposes has two categories: low power ultrasound for therapy and high power ultrasound for destruction of tissue. Low power ultrasound of 1 and 3 MHz are used in physiotherapy to reduce pain and promote soft tissue healing in a variety of conditions. The high intensity focused ultrasound beam is used for surgical purposes. Lithotripsy uses high pressure ultrasound waves to mechanically dissolve the kidney stone. The ultrasound is also used in dental drills. Ultrasound is high frequency mechanical vibration produced by the rapid oscillation of molecules of a medium. The literal meaning of ultrasound is the sound that is beyond the reach of human hearing. Sound waves are the mechanical waves that when reaches ear excite the auditory nerve and makes us listen. The vibration of only certain frequencies are audible and the sound word applies to those vibrations. As we know, the frequency of sound wave ranges from 20 to 20,000 Hz. The waves of frequency above and below this range are not audible. The waves below the frequency of 20 is known as infrasound, whereas the waves of frequency above than 20,000 Hz are known as ultrasound. In physiotherapy, the frequency of ultrasound is 1 MHz and 3 MHz. The physical properties of ultrasound to a greater extent is similar to that of sound waves. Both are the mechanical waves but with different frequencies. A mechanical wave is produced due to regular compression and relaxation of the molecules of the medium when subjected to force. The mechanical force transfers its energy to molecules of medium, and as a result they move to and fro from their mean position. It is the periodic movement of molecules that creates the waves of energy. Mechanical waves require a medium for creation and transmission, and these waves cannot be set up in vacuum. Therefore, unlike electromagnetic radiations like shortwave, infrared or microwave, the ultrasound cannot be created in vacuum, and they essentially require a medium for creation and transmission. The speed of travel of such wave of vibration is different in liquid, solid and gas. The medium where molecules are loosely held and stays in close contact, the transfer of energy from one molecule to other is easy, and the progression of wave takes place at faster pace. In air and gases, the molecules are spread far apart, and therefore the speed of sound in air is least. In liquid and solid, sound waves travel at a faster speed than in air. There exists inverse relationship between frequency and wavelength. As the frequency increases, the wavelength becomes short. At the frequency of ultrasound, the wavelength becomes so short that it does not propagate far in the air. Sound waves can be transmitted in air, but ultrasound does not travel far in air. The history of development of ultrasound is interesting. Ultrasound is mechanical wave of high frequency. However, it is not possible to produce such high oscillations through mechanical means. The discovery of the phenomena of piezoelectricity by Pierre and Jacques Curie during 1880 paved the way for the artificial production of ultrasound. Curie discovered that when mechanical compression is applied to certain materials, it produces electric current. They call this phenomena piezoelectric effect, and the substances having this property were termed as piezoelectric material. Later on, it was also discovered that exposing such material to varying electrical current could produce mechanical deformation in those materials. This effect is known as reversed piezoelectric effect, and this provided the foundation for artificial generation of ultrasound. The property of piezoelectricity is possessed by many naturally occurring crystals such as quartz. Some synthetic ceramic materials such as barium titanate or lead zirconate titanate also demonstrate the properties of piezoelectricity. Practical application of the Curie's discovery was not realized until World War I. During those periods, the scientists started considering the possibility of using sound waves to detect the submarines and icebergs. They utilized high-frequency oscillating electric currents and the piezoelectric crystal to produce ultrasound of various frequencies. The investigations in this direction led to the development of sonar. The ultrasound device for therapeutic and imaging purposes were emerged as the byproduct of this research. The therapeutic ultrasound machine has three components: a transducer or a piezoelectric crystal that emits ultrasound, a multivibrator circuit for production of high frequency current, and a controlling unit that regulates the production and input of high frequency current to the transducer. The transducer consists of a slice of piezoelectric crystal mounted on a metallic plate. It is connected through coaxial cables to multivibrator unit. The high frequency electric current produced in multi-vibrator circuit apply an oscillating voltage to the transducer. This makes the crystal vibrate at the same frequency as that of oscillating current. The vibration of crystal produces identical vibration in the mounted metal frame that emits a beam of ultrasound. The sonic beam of transducer is roughly cylindrical and is of same diameter as that of transducer. The multi-vibrator circuit has a controlling unit based on a stable multi-vibrator which can turn the multi-vibrator circuit on and off, and it gives the pulses of ultrasound. A suitable resistance circuit is also provided to control the amplitude of electrical oscillation, and this regulates the intensity of the emitted ultrasound. Intensity describes the energy content of ultrasound beam. It is measured in watt per centimeter square. A therapeutic ultrasound can produce intensity up to 3 watt per centimeter square. The imaging ultrasound uses very low intensity ultrasound beam, but in destructive surgical devices, very high intensity beam of ultrasound is used. The distribution of ultrasound energy within beam is not uniform. It has high peak and low peak of intensity. The degree of non-uniformity of ultrasound beam is measured as beam non-uniformity ratio, which is the ratio of the intensity of highest peak to that of the average intensities of all peaks. BNR depends on the piezoelectric quality of the crystal of the transducer. A crystal having high piezoelectric properties gives more uniform beam and thus has lower BNR. A good transducer should have lower BNR. The high BNR increases the chance of uncomfortable sensations during therapy. The beam of therapeutic ultrasound should be between 2:1 to 8:1. During transmission, ultrasound beams transfers a portion of its energy to the molecule of medium and make them vibrate. This phenomena is called absorption of wave. It is the absorption of wave that produces effect on the body tissue upon exposure to ultrasound. If ultrasound is not absorbed in a tissue, it will not produce any effect. The absorption of ultrasound on body tissue depends on the frequency of ultrasound, intensity of ultrasound, and the nature of the ultrasound. At higher frequencies, most of the ultrasound is absorbed at superficial tissue. The frequency of ultrasound influence the absorption and reflection of waves. These processes produces loss of energy contained within a beam of ultrasound as it travels further from the source. This phenomena is known as attenuation, and it is explained by the concept of half-value distance. The depth at which the energy of ultrasound is reduced by half of its original value, it is known as half-value distance. At 3 MHz, the acoustic energy in tissue is reduced to half within 1.5 centimeter, whereas the half-value distance at 1 MHz is about 5 centimeter. The half-value distance is an indication of the penetration ability of ultrasound. Besides frequency, the intensity of ultrasound is another important factor that determines its effect. The higher is the intensity, more shall be the thermal effects. The imaging ultrasound utilizes very low intensity ultrasound beam whereas destructive surgical devices use very high intensity beam. In physiotherapy, the intensity ranges up to 3 watt per centimeter square. Pulsed ultrasound delivers relatively less energy in comparison to continuous ultrasound. The absorption of ultrasound in different tissues is not uniform. The tissue with a high protein content absorbs the ultrasound most. The collagen tissue has higher protein content and therefore they absorb the ultrasound most, and as a result the effect of ultrasound on body is more pronounced on the tissue having high content of collagen fibers. The effect of ultrasound on the body can be described under two broad headings: thermal effects and non-thermal effects. Thermal effect is the production of heat, whereas non-thermal effect refers to the mechanical effects of ultrasound, which is produced due to the high frequency oscillations of the medium which absorbs the ultrasound. The absorption of ultrasound leads to generation of heat within tissue. Ultrasound has the ability to produce a rise in the temperature of tissue up to the depth of 5 centimeter. The tissues having high protein content such as collagen fibers absorbs ultrasound energy more readily and thus are affected to a greater extent. This makes ultrasound the modality of choice in treating deeper tissue having high collagen content such as tendon and joint capsules. It is used as a deep heating agent to increase selectively the temperature of periarticular structures and at bone muscle interface. Due to its selective heating properties, ultrasound was also referred as ultrasound diathermy. The higher frequencies produce superficial heating, whereas the frequency of 1 MHz is used to increase temperature up to 3 to 5 centimeter depth. Continuous mode obviously produces more thermal effect than pulsed mode. The increase in temperature has associated effects like increasing the extensibility of tissue, making them more pliable. Pain relief and increased blood flow are the other effects of temperature elevation. Stretching following ultrasound exposure has been shown to increase the length of tissue that contributes to reduced stiffness. Increased blood flow of the part is another effect of temperature elevation that can have numerous benefits in terms of waste product removal and increasing nutritional supply of the area. All these could contribute to tissue repair and pain relief following injury. On many occasions, exposure to ultrasound also produces several important bioeffects without producing elevation of tissue temperature. These effects are known as non-thermal effects or mechanical effects of ultrasound. Non-thermal effects can cause change in cellular activity by altering the permeability of cell membrane. These can have significant effects on tissue repair and regeneration. Cavitation, microstreaming, standing wave formation and micromassage are the important non-thermal effects of ultrasound, which are produced due to high frequency pressure oscillations associated with the exposure to ultrasound. Cavitation is the formation of tiny bubbles in a gas containing fluid under influence of a mechanical wave. There are two types of cavitation: stable cavitation and unstable cavitation, which is also known as transient cavitation. Unstable cavitation or transient cavitation is rapid change in the size of bubble leading to explosion and rupture of bubble. This may cause significant accumulation of energy and may produce tissue damage, especially of small sized blood vessels. The chance of unstable cavitation are more if the ultrasound intensity is at higher level. Stable cavitation is associated with low pressure amplitude. In this type of cavitation, the formed bubble does not explode, but it expands and compresses under the influence of pressure amplitude variation, and it oscillates to and fro. Stable cavitation can produce reversible permeability changes in the membrane of cells lying in vicinity. Cavitation is closely related to another phenomena called acoustic streaming or microstreaming. It is the unidirectional, localized, steady circular flow of fluid around the cells. Both stable and unstable cavitations produce microstreaming. Microstreaming is believed to play a significant role in therapeutic effects of ultrasound. It may alter the cell permeability and influence the rate of ion diffusion across the cell membrane, and this may lead to subsequent changes in the cellular activity. Increase in cell membrane permeability and vascular wall permeability produces several therapeutic benefits that can contribute to accelerated healing and repair. The another mechanical effect of ultrasound is micro-massage. The alternate compression and rarefaction of tissue may produce a kind of micro-massage that may help reduce edema. The non-thermal effects of ultrasound produce several biological effects. Some of these beneficial effects include increased calcium flux across smooth muscle membrane, increased serotonin secretion from mast cells, increased mobility and activity of fibroblast, increased protein synthesis, and increased production of growth factors by macrophage. These effects accelerate the healing and repair of injury. In acute stage of inflammation, ultrasound has a pro-inflammatory effect, and if the original inflammatory stimulus is removed, ultrasound can accelerate the resolution of inflammation. In the management of musculoskeletal injuries, ultrasound plays major role. Therapeutic ultrasound is routinely applied in case of acute and subacute soft tissue injuries such as sprain, strain, contusion, bursitis, etc. It is also used in rheumatoid arthritis and osteoarthritis, joint contracture, skeletal muscle spasm, pain, tendonitis are the other conditions where the effectiveness of ultrasound is claimed. The role of ultrasound in breaking adhesion and increasing pliability of connective tissue due to selective temperature rise make it a powerful adjunct to the treatment program of adherent scar and soft tissue contracture. With some precautions, ultrasound can also be used for accelerating the healing of open wounds and ulcers. Ultrasound enhances the permeability of skin, and this effect is utilized to enhance the absorption of drug through skin. This method of drug delivery is known as phonophoresis. The common drug delivered through these methods are hydrocortisone and salicylates. Therapeutic ultrasound is considered as a relatively safe modality. Therefore, it is not uncommon to see players applying ultrasound themselves. However, this practice cannot be justified. Like any other therapeutic modality, the effect of ultrasound are dose related that may vary according to healing status of tissue. Therefore, ultrasound should always be administered by those who have a thorough knowledge of this modality and also have the ability to detect the different stages of healing in an injured area. Inappropriate dosimetry or improper selection of area may produce excessive heat buildup leading to deep burn and damage. Ultrasound should not be applied in condition where the heat dissipation capacity of the body is reduced. Example of such conditions include severe ischemic disease and deep radiotherapy. Since ultrasound seems to accelerate the cellular activity, treatment over rapidly dividing tissue such as cancerous growth or tubercular region should be avoided. For the similar region, application of therapeutic ultrasound to pregnant uterus should be avoided. Although some would argue that pregnant uterus is the indication of diagnostic ultrasound, but it should be noted the intensity used in these two applications are entirely different. Areas near eyes and gonad should be treated with extreme care as the fluid-filled cavities offer excellent transmission ability to ultrasound, and this increases the possibility of damage to retina or gonads. The effects of ultrasound are dose dependent. The intensity, frequency and mode are selected carefully after examining the condition and deciding the required therapeutic effects. For deeper tissue, frequency of 1 MHz should be used, whereas for superficial tissue, 3 MHz frequency shall be appropriate. If the non-thermal effects are desired, then low intensity and pulsed mode should be used. Ultrasound is applied by placing transducer in close contact with the affected body part. There are three techniques of application: direct application, water bath and water bag techniques. The technique of direct application is suitable for flat areas of body such as back and neck. For irregular and small areas with bony prominences such as elbow, foot, ankle or hand, the other two techniques are preferred. Water bath technique is also used to apply ultrasound over open wounds. Ultrasound is markedly attenuated and reflected back at the ear tissue interface. Therefore, it is important to eliminate as much air as possible between transducer and the skin. A coupling agent must be applied over transducer head and also over the skin. During application, the treatment head must be moved continuously to iron out the irregularity of beam and avoid point concentration of ultrasound to some areas. This may give rise to hot spot, which may produce damage to the tissue. At the end, now we summarize the major points of this lecture. Ultrasound is a mechanical pressure wave. It has properties similar to that of sound, but unlike sound, the ultrasound cannot travel in air. When the body tissues are exposed to ultrasound, they absorb ultrasound. The absorption of ultrasound produces both thermal and non-thermal effect. The absorption of ultrasound is high in the tissue with high protein content. Therefore, muscle, tendon and capsules can absorb the ultrasound more readily and can be heated easily. The penetration of ultrasound is up to 5 cm and therefore it can be used as a localized deep heating agent. The effects of ultrasounds are dose dependent. Therefore, adequate care should be taken in deciding the dose by properly examining the area to be treated. Thank you.